Hello and welcome to Cota Access. My name is Simone Brunozzi. I'm an operating partner at Cota Capital. And this month's Cota Access is about COVID-19. And the title is Going Viral, the Future of Human Health, Pandemic Resilience, and Biowarfare. This part that you're watching now is recorded after the event, which happened on February 25th. The reason why we needed to add this small chunk of video before the actual recorded event is that due to a technical glitch, we missed the first few minutes of the event that we recorded. So I need to tell you a bit about this particular event and briefly introduce the two speakers, and then we will get back to the actual recorded video of the event. So Cota Access, as you might know, is a recurring webinar that we host several times a year, where we bring together founders, thought leaders, leading executives, experts to explore a variety of topics on business and technology trends that fundamentally impact large enterprise companies. Cota Access is organized by Cota Capital, an SEC-registered multi-stage investment firm based in San Francisco, California, focused on US-based modern enterprise technology companies. Cota has invested in more than 75 private and more than 25 publicly traded technology companies since its inception in 2015 in the fields of computer infrastructure, workflow automation and applications, fintech, and health tech and life sciences. And of course, in the links to this video, you will be able to see the website, the YouTube channels, and other social media channels that Cota Capital uses. As I was mentioning at the beginning, this particular Cota Access event is focused on COVID-19. And for that, we have invited two amazing speakers, Milana Boukhman Trounce, MD and MBA from Stanford University, and Gigi Kwik Gronvall, PhD from Johns Hopkins University. They have been leading key COVID-19 initiatives at their respective institutions, Stanford and Johns Hopkins. They teach, research, speak, lead, and generally are considered among the top experts in the US and also elsewhere on the topic of COVID-19, vaccination, synthetic biology, and many other important topics. And today we spoke with them about several subjects related to COVID-19. The recording of the event that you will be able to watch in a very short amount of time starts with them answering the question about what should we expect in the future? What's the next pandemic going to look like? Is it going to be called SARS-CoV-3? Is it going to be another COVID type of virus? Or is it going to be an influenza type of virus? So essentially, the first question that they will answer is about what did we learn so far from this current pandemic to understand what we can expect for the next several years. And of course, hidden in that question is what should we do differently? What can we do better the next time that something like this happens to respond in a much better way? So thanks for listening to me. And now let's go to the recorded video of the event. Thank you very much.
What I've been telling people is to just look at the real world data, because the laboratory data is going to be a little bit more scary than the real world data, because our immune systems are a lot more complicated and better prepared than just looking at a test tube and seeing how vaccines may interact, how antibodies may interact with the different variants. So it's going to be a story that's going to be with us for a while as more people are looking, but that doesn't necessarily mean that that the sky is falling. So it's important to keep these things distinct.
Nice. Yeah, that's a really good perspective, Gigi, on the evolution, and it's fascinating. There's so many new variants and new information about this coming out all the time. But to address the question, Simone, about the long COVID, so there's a lot of data coming out. Actually, the latest, there was a JAMA article on this, kind of even came out earlier this week, kind of looking at the long COVID, and it looks like, according to statistics, about a third of the people get some kind of symptoms kind of beyond the initial immediate post-viral kind of period. And sometimes these symptoms do last for months. And what's interesting, again, with this new JAMA article that came out, actually, it looked at people who were not hospitalized, because prior to that, most of the studies were in people who were hospitalized. But unfortunately, even if in people with relatively mild to moderate illness, some of these symptoms, unfortunately, can be persistent. And the most common, some of the more common symptoms that people describe are like headache, fatigue, kind of persistent, loss of taste or smell. So kind of these vague kind of systemic symptoms. And, some of them can be fairly severe. Most of them are kind of not severe enough to kind of interfere with the daily functioning of people, but some are. And unfortunately, this is something we don't, it's not, I can tell you, is not particularly typical for the kind of your usual influenzas or kind of the things that we normally see. So this is something that looks like it's an unusual thing for this virus. And about the new variants and the evolution of new variants, again, we're gathering data. There was actually just a study that came out. Actually, it didn't even come, I don't even think it was published yet, even in
Can we share the secret, or is it too
yeah,
secret?
no. Yeah, I can share the secret. But yeah, I don't even, yesterday it wasn't even in preprint. I don't know about today. But actually, it's a study. The news of this are kind of starting to break out. A study done out of UCSF with the California variant. And we were talking about this, Gigi, yesterday with you yesterday about, they analyzed over 2,000 samples in California, and it looks like this new variant is becoming more and more prevalent, at least in California, but it's not only in California. So don't think you're necessarily safe if you're not in California. But this new variant appears to be more lethal and potentially more contagious as well. And at least in the lab, and, this goes back to saying what, Gigi said, it's hard to know whether this is just something for the lab or whether we will see this actually clinically, but something that may be partially, not as well, not where somewhere where vaccines might not be as protective. But again, these are lab findings. Like Gigi mentioned, these are not clinical findings yet, so it's difficult to say with certainty. But they looked at, there was data of 2,000 samples, and they looked at over 300 patients who were actually admitted at UCSF with this variant. And something like, you were 10 times more likely to end up in the ICU if you had that variant. So, that was concerning enough, but, still relatively small study. So we'll have to wait and see. But I think, bottom line, I mean, that underscores that interrupting transmission is key, because we will always be chasing our tail with vaccinations. We'll always be chasing our tail with, medical treatments, and frankly, even tests. Although it's so nice that we can sequence these kinds of things, and there's so much more effort to sequence them. But I feel like, again, interruption of transmission is key. So I know there's so much temptation to relax, and everybody has COVID fatigue, but we're not quite out of the woods yet, unfortunately.
We're not out of the woods.
Yeah,
I agree. And you mentioned vaccination. So the next question I have for you is related to vaccines, in particular messenger RNA vaccines. We know that those are the most common. At least, Pfizer and Moderna have both developed mRNA vaccines. And they are the first of their kind, as far as I know, correct me if I'm wrong, to receive FDA approval in the US. And as we know, or at least us, reading and trying to become MDs all of a sudden overnight, people like me, we know that the main difference is that instead of introducing the antigen itself into the body, those vaccines contain the genetic instructions, the messenger RNA, for making the antigen. So that's a very substantial difference. And of course, this allows for, I feel, as a general comment, for a better vaccine compared to the vaccines we could have used in the past. But tell us what's next, what's ahead in terms of the power of these vaccines, in particular in relation to new variants, but also in the long term. 5 years from now, 10 years from now, is this going to be a much better weapon or defense, let's say, against other, COVID infections or potentially other type of pandemics that could hit the general population of Earth in the future? What do you think?
Would you like to start?
Sure. Although this is a great question for Gigi, but I'll just offer a bit of a perspective before she delves into it further. You mentioned a weapon, and I actually recently learned by speaking with somebody who runs ChemBio office, a Defense Threat Reduction Agency, that these vaccines were actually, this approach was actually initially developed by DTRA, which is part of the Department of Defense, which, you know, I didn't quite appreciate, specifically to develop a faster response, to develop our ability to fast respond to pandemics and kind of emerging biothreats. So one of the things that's nice about mRNA vaccines is the speed. And again, Gigi can comment a lot more on that. But I think it's a really great tool for us to respond, better respond, particularly to emerging infections, and also even to new variants. Because even with this, with COVID, I know there's discussions now about kind of having booster shots or things like that, which are more specific to South African strain or, you know, or others. So Gigi can tell you a lot more about that.
Well, actually, Moderna, I think, announced a day or two ago that they are starting to do trials with a modified version of their vaccine that might be used as a booster in the future. But just to say right up front, all of the vaccines appear to be at least the Pfizer and the Moderna ones that are now have emergency use authorization in the U.S. They appear to still have very good efficacy against the variants, and so when you get a chance, take the vaccine. And so as far as the future of mRNA technology, and like Milana was saying, these have been worked on for decades, even though it's now they're at center stage. So there's been a lot of research into this type of methodology, and it has advantages, and it may be easier to change out some of the sequence so that it might be able to be more easily modified. Although making a vaccine is not an easy step. I mean, it's not an easy thing to do. There's a lot of steps involved, and for purification and making sure that it's expanded to the number of doses that we need. But it's got a lot of a big future in other diseases, not only other infectious organisms, but there are people looking at this technology for cancer therapeutics. In fact, some of the small companies that were helped along by bigger pharmaceutical companies to bring these vaccines to market were working on cancer therapeutics. So that's where they thought the mRNA vaccines were going to be most useful. So I expect we're going to see a lot of products that are using this technology, and a lot of other companies that are going to support this type of technology, because there are enzymes that are used in the making of this that were not used in other vaccine methodologies. And so those are going to be new supply chain issues that so need to be supported with other companies.
Yes, makes sense. And speaking still about vaccines, one of the things that worries people when getting vaccinated is reactions to vaccines. It's also, unfortunately, one of the critiques that less inclined people, move against vaccination. But we know that reactions to vaccines are actually because of the way vaccines work. They stimulate the immune system, and of course, coughing, sneezing, fever, runny nose, watery eyes, these kind of things are essentially the immune system's response to a pathogen, trying to get rid of it. So it is pretty much natural to expect some form of reaction from the body. But then at the same time, there's several unresolved questions about reactions, and in particular also the impact on the how contagious you are after having been vaccinated. Of course, you can expect a person to be less contagious after having been vaccinated, but what's the current knowledge about it? What can we say for certain, and what do we expect to, maybe to prove long term about, side effects or reactions to vaccination? And also, are we contagious? If so, how much after having been fully vaccinated?
So side effects, I'm going to ask Milana to do that, but let me just jump in on the transmission aspect. So,
Yes.
so it's been a pretty hot topic, and I think a lot of public health officials haven't wanted to overpromise on the vaccines because they want people to still wear masks and so forth, because I mean a vaccine is not, it's not like a bug zapper. I mean, it's not going to like reach out around you and kill the virus if you encounter it. If you're vaccinated and you you get exposed, you're going to get infected. It's just that your immune system has already been put through the paces, and it's going to be able to get to work and get rid of that infection. And so that's how the vaccine works. So it's better, and like ideally, to just not get exposed to the virus. So then the question is, so you get exposed, you're vaccinated, but is your immune system good enough about making sure that the virus doesn't replicate, so that it doesn't end up a lot of it in your nose, so that you breathe it out into the air? And that's the question that people were like, oh, we're not sure yet, so let's wait. So it might happen that you might be able to transmit a little bit, but it's not clear that it's going to be enough to actually infect somebody. So that's why they're recommending that, if you're around other vaccinated people, probably, I wouldn't worry about it. But if you're going to be around somebody who's vulnerable and who is, hasn't been vaccinated, you might want to take a few extra precautions until the spread of disease is much lower than it is right now in the community. Yeah. And then once it's rare that people get infected, then we're all going to be a lot more protected.
Absolutely.
Yeah. Yeah, no, it's totally agree with Gigi on that. And I'll just talk briefly about the side effects. Have 2 points to make. So one of the most serious side effects is anaphylactic reaction. Is basically a very severe allergic reaction where you can end up in ICU and things. As an ER doc, to be honest with you, it's routine, like not a big deal, like totally treatable. That this is the reason why you're observed for 15 minutes after getting the vaccine. So kind of don't let that scare you. Not a big deal. Like, we treat this. As far as longer term side effects, anytime you're getting vaccine, you kind of have to think about the alternative. And that I can't help think, but, they had, people used to have, chickenpox parties, but even when you look at kind of the old school smallpox vaccination, where you could actually, where you took a little bit of the live virus, and, from a scab of the person infected with smallpox, which by the way, had 30% mortality, and you would use that to vaccinate. That was the initial kind of, and you would use that to kind of, people in India used to do that. And there was 1% of chance of dying from these types of things, but people still did that because that 1% was better than 30% chance of dying. So again, every time you take a vaccine, you look at the alternative. And then again, now with the data coming out with the long COVID, even in people who are young and who have had mild symptoms, I'm just not sure it's worth it. And, indeed, you're going to have more side effects. You'll hear, more as more people are getting immunized, you'll hear that more and more people are having kind of serious side effects, after the second shot. Basically you can spend a day or two in bed. Like, when I got vaccinated, that's what happened to me. But, this is just, this is something that you take because, again, the alternative potentially is less pleasant than these side effects. Yep. And again, so far, and Gigi can comment more on that, as far as a kind of a longer term serious side effects, we haven't seen a whole lot. Some things, with vaccines, we worry about Guillain-Barré, like paralysis. And this is kind of what I was worried about, when I was first hearing about these vaccines. But so far, so good. We haven't had kind of these scary, serious things that are not, they're difficult to treat.
That's great to hear. And by the way, in the meantime, we've been getting some questions from the audience. There's 3 currently. And, now speaking to the audience, if you have additional questions, feel free to type them. We won't be able to maybe cover all of them, but there's one in particular that I think is a good segue to what we're just discussing now. It comes from Lale Masnavi. I hope I pronounced your name properly. And I'll summarize the question. The question is, how long do we expect the immune effect of vaccination to last? Is it just a few months, as everybody's been saying lately, or is there something new, something more precise that we can share with the audience?
Yeah, so for a lot of diseases, we know exactly when we should tell people to get a booster shot. So you know that if you haven't had your tetanus shot and it's you step on a rusty nail and it's been more than 10 years, like go to the doctor, get your shot, and take some some action. But when it but that's because we know what they call correlates of immunity. We know that you need to have antibodies that are a certain titer, that you need to have your shot within a certain number of years. And there's just a lot more unknown here for how long the vaccines are going to last, how whether it's antibodies that we're going to need to measure to see if the vaccine is still effective, or whether there's another part of your immune response that we should be measuring. So I think people are saying 1 or 2 years right now, but we'll see. And I think that it really is, that's about as precise as that's what you should hear. And if you hear anything more precise than that right now, that people are they're a little bit on shaky ground for sure, because we just don't know. We've only experienced this disease for a year and a couple of months, and the vaccines for much less time.
Absolutely. And also I want to add to that, I think it's important to realize that, again, correct me if I'm wrong, boosters, essentially recalls to the vaccine that you maybe did a year ago or 2 years ago, are potentially not going to be as impactful in terms of side effects to your body, because essentially they need to be, again, I'm using bad terms, but forgive me if it's too imprecise. They can be weaker to obtain the effect of refreshing the memory of the body in how to react to a certain virus. So essentially, as long as we can, combat the current pandemic, which is the biggest problem, then once it's under control and once it has become a relatively rare disease, then problems related to how often we need to vaccinate and stuff like this is going to be, I think, much less critical to our ability as Earth to get back to potentially a normal life. There's another question that I want to share with you, and this question will make me look particularly dumb. So because half of it I can't even understand what it is about, but I think the way I understand it, I think it's also a relevant question to what we were discussing. So the question is from Roberto Bassi. The question is, what's your take on the rate at which viral epitopes mutations are happening, and how this will impact the efficacy of current vaccines? Do you see a scenario where SARS-CoV-2 vaccines will need to be taken every year, as you were mentioning, similar to flu, and masks will be a commonly used PPE for essentially the future? Or do you think that we will, essentially go back to normal and pretty much, forget about this COVID pandemic in a few years' time? What's your take?
Maybe I can say a couple of things and then definitely defer to Gigi.
Yes.
What's interesting is that the Spanish flu pandemic, and again, I keep coming back to Spanish flu, but I think it's very telling because it actually happened. And like Gigi said yesterday, biology is not a theoretical science. So that's why I like these questions.
Yes.
So with Spanish flu pandemic, everybody knows that most people think, oh, it's only been around for a couple of years. Actually, the Spanish flu viruses have circulated for somewhere like 30 years, like a few decades after it actually happened. So thinking about it like, oh, it's going to go away in a couple of years, like that ain't happening. How much of it will circulate and how widely it'll be prevalent is another question. I think what's interesting in today's environment is that and how do we compare it to the Spanish flu pandemic? We're far better able to isolate now. And they didn't have telemedicine, they didn't have teleeducation, they didn't have telework 100 years ago. So on one hand, while it's really nice to have that, I wonder if that's actually going to prolong how long these kinds of things circulate. On the other hand, we have vaccines now. So these things, so maybe it'll all balance out in the end. So, but we're not, completely out of the woods. And from what I keep hearing from experts like Gigi and others is that, these kinds of things may turn out into kind of a yearly thing where we might like an influenza. It's not, we know, and we accept the fact that if we have to get flu shots every year because the viruses mutate and viruses change. It's still an influenza virus, but they mutate and change. So something similar might have to happen for coronaviruses. And Gigi, I'm sure we'll say a lot more.
Well, I'll just add to that I mean, flu is it's around, and we're going to have to deal with that in the future. So, and they mutate pretty quickly, and we vaccinate against several strains every year. So it's there's multiple viruses that we might encounter every year. But this particular one, I think it's going to keep changing. There's going to be new variants that arise. And we're going to do our best to vaccinate and bring community transmission down. But the world is a big place. And I think it's important to remember that, if we've learned nothing else out of this year, that infectious diseases don't care about borders, and that, as long as the infections are raging in lots of other countries, we're going to have a problem. And so efforts like COVAX to vaccinate the world are really critically important. And it's not, it shouldn't be framed as charity or giving away vaccine. If the whole planet's on fire, we need to put out the fire where there's fire, not just, in our neck of the woods.
Absolutely. And you mentioned countries. I think it's a good segue to a question that we have received in advance to the event. The person asking the question is Don Clark from Telecom Foresight Consulting. The question he has is the following: it will be interesting to compare and contrast the pandemic resilience of different societal healthcare models. For example, the US system compared with the Canadian one or European systems. And I know that you have a lot of interest in comparing it with the South Korean system. So maybe you can give us some comments, because most of us are familiar with just one system. I think it's important to understand the main differences with, between, for example, the US and South Korea, if that's a good pick that you want to take.
Yeah, sure. I mean, the reason why South Korea, rather than say UK versus US or Europe, is because their system is quite a bit, so much different. And what's interesting about South Korea is that South Korea has had a MERS, which is a scare, which is a Middle Eastern also coronavirus. That thing had a 30% mortality. So it was quite scary. And actually, and as a result, there was a lot of new legislation after that MERS. It was very political back, there, as a result of this. And they actually passed a lot of laws which targeted how they deal with things like that and with the outbreaks. So in a way, I feel like that made them prepared a lot better for this one. And it would be nice if we kind of learn in a similar way in the United States. But basically, one of the things that the issue was with them during MERS time is that their government did not release information about where infected patients were, and people basically got really mad. People said, let's change the law. This should be transparent. We have the right to know where infected are, so we avoid them. And so they really kind of swung a whole other way, where they passed legislature and how they that actually, I'm not sure would really fly in the US because of privacy, but basically they have automatic contact tracing, and they collect information like from your credit cards, where you wear, if there is an outbreak in a restaurant, everybody who was there in the restaurant, again, by credit card data and also Bluetooth technology and others, gets notified automatically. You're exposed, go quarantine. Somebody can, public health officer monitors them. Every person who is supposed to be quarantining, all of that, again, is technologically based. So they're just much, much better than us at using technology, which does have some costs associated, kind of privacy, at basically doing automatic contact tracing. And they've really ramped up their public health system to be able to deal with that. And they've also largely, I would say, depoliticized kind of their pandemic response, which has been kind of one of the issues that we've had to deal with in the US. But, they've also learned the hard way. So, so again, there are numerous differences in how they approach this, but they're far more organized. They're, as far as their testing rollout, their PPE. Again, they've had time to make changes, and they've had time to get much better prepared. And I hope, frankly, we follow suit with at least some of these things, which can be more doable in our context.
And before Gigi answers, I just want to point out, which is very interesting for me, that those things are doable. There's nothing preventing every country from learning from the few ones that have suffered from SARS, because SARS thankfully did not affect the entire world as COVID-19 did. But also, even after this pandemic hopefully ends, and after we go back to some quote unquote normal times, I think it will be a great opportunity to just learn from what we have learned collectively and say, what do we need to do without inventing, fusion power or other things? We don't need any new technology to be able to be better prepared. So it's more of a political, organizational, logistical, in a way, effort, rather than we need to, discover something new to be really prepared next time. And thanks for this. I think this was really interesting. Gigi, did you have anything to add to the South Korean versus US comparison?
Yeah, so they were also really rapid with their testing, and so testing became immediately available, and people could get tested freely as much as they had the opportunity to, and that was a really big deal. And they also had the opportunity to, if they were sick, to stay home, which is another thing that was not possible here. But South Korea is a really interesting example, but even the UK, I think they have learned a lot more about what has happened in their hospitals and how well treatments work or don't work based on using the data in their national health system. And so being able to learn from the clinic has been a little bit more rapid in the UK than here. But the political nature of disease, I mean, it didn't used to be this way. And we also learned from SARS the first time, and we were really preparing for flu because we were worried about avian flu in 2008 with George W. Bush as president. There was a lot of bipartisan concern, but the nature of public health is that, if nothing happens, it's very easy to take money away from people who are preventing harm. And so I hope that is a lesson that you just because you haven't had a fire in the last year, it's really not a good idea to get rid of the fire department.
Yeah, I like the fire analogy. I was exactly thinking that when you were describing this issue, because when there's no fires, it's easy to think, oh, we don't need that. It's just too easy. But then at the same time, we need political leaders and voters, and essentially the general population, hopefully, thanks to this terrible pandemic as well, to realize that we need the fire extinguisher, even more so when there's been a few years without fires, because we're even less prepared if we just give away the structure, the infrastructure to be able to respond to these things. Let's open up now the other topic that we mentioned in our title, which is essentially biosecurity and biowarfare. First of all, I think it's interesting to define biosecurity. So maybe one of you two can take a stab at it for the audience. How do we define
Milana,
biosecurity?
why don't you take a stab?
Sure. Since I teach a class in this, I have to say it over and over for the last 10 years. So biosecurity is defined, I think, best in the words of David Fidler, who actually wrote a book on biosecurity, and he's one of the eminent legal experts. So he defined it as a collective responsibility to protect society from infectious organisms, whether they're intentionally released or naturally occurring.
That's pretty good. And Gigi, I guess there's not much to add there.
That's a good definition.
Yes. So now that we have defined what it is, let's explore how, you mentioned a few things already, but how can we be more protected against biowarfare of any kind? And before you answer, I'll actually mention a question from an anonymous attendee that I think is very relevant. That person asks, would it be a good idea to share the vaccine formula globally to accelerate the prevention or other type of actions? And I think it goes back to the general question of how can we be more protective collectively, not just as an individual nation, but globally, because the nature of these pandemics can be global, as this one is. How can we increase our resilience against, biowarfare?
Mm-hmm. Well, there's a lot of things that we can do on many different levels. Surveillance is really important. So learning about what's out there, and getting better at determining what is natural and what might not be. We have benefited from some of those investments. So, like in the early days of COVID, there was not really. I mean, yes, there are conspiracy theories, and we could talk about that. But
we shouldn't.
but it was pretty easily any sort of claims that it was a deliberate event were pretty easily put to bed from our own Defense Department, which had spent all this time analyzing what would be the signatures of a natural versus a deliberate, deliberately engineered virus. And so it was kind of like run it through the algorithms. Yeah, this is natural. Nature did this. This is a lot more novel in ways that we wouldn't predict. And so those kinds of investments are really important for assurance and for deterrence, and being able to assign who might be the designer of something that if it was untoward, right?
And let me add, even to foster cooperation, because once you are sure that there was no intentional release of this particular virus, then it's easier to say, okay, let's work together. We can trust other countries and in trying to fighting this pandemic, right?
Exactly. And as far as other things that we can do, it's not just science. Scientific cooperation is really important to build trust across countries, even if when there are political disagreements. But there are treaties. The Biological Weapons Convention still is in force. It prohibits nations from developing biological weapons or stockpiling them. There are other mechanisms that make sure there's a UN Resolution 1540 where nations are obligated to make sure that they do stuff so that non-state actors are not using biological weapons. I don't think you can ever really, just like epidemics, you can't totally stop the prospect of somebody misusing biology, but you can certainly get on top of it much more easily with surveillance and have the legal instruments to bring people to justice if that's where you're going.
Yeah, and not to diminish the complexity of this, but I feel, some people might know my background is in computer science, so I know close to nothing in relation to medicine, but many of the things that you were describing now remind me a lot of computer security in a sense, because there's always trade-offs and incentives and mechanisms at play where even if you cannot completely eliminate the risk of certain threats, at least you can make them expensive or hard to deploy, against your targets and similar types of actions, in ways that essentially overall the effect you have is that you can feel pretty safe in terms of computer security or in relation to your health. You can feel pretty safe, but also you can minimize or mitigate most of the potential threats, even if they come from either the natural world, they occur naturally, or even if there are ill-intentioned individuals or organizations that decide to do something against other people. So the interesting thing about this parallel, though, is that it is, I think, important to increase the level of awareness of the people involved, not just at the top level, not just the executives and the decision makers, but even the general public in a sense. And on this front, I think that the COVID-19 pandemic has helped us realize how important these topics are. I have serious doubts that computer security will ever become this discussed, unfortunately, but at least on the healthcare front, we have an opportunity here to educate people, to make them more aware, to help them understand certain mechanisms better. And of course, general population means usually voters, means usually elected leaders, means a chain effect that potentially has good effects overall. And again, about biowarfare and biosecurity, what do you think that are the long-term threats that we should be most concerned about? And I'm not trying to scare the audience or to scare all of us, but given what you know, feel free to speak freely. Let's say 10 years from now, 15 years from now, what do you expect based on what you know today? What do you expect that at the current state of affairs, there could be a certain type of threat or certain type of mechanism that we are still unprepared against?
I am concerned about the degradation of international norms when it comes to biological weapons. And I think I have some concerns that the demonstration of COVID and how it affects economics, how it affects lives, how it can affect economies. I worry about how the lessons that may be learned by particular actors on that. And so I think there's, I worry that that biological skills are much more prevalent now than they were at the time that the BWC was signed, the Biological Weapons Convention was signed, and I worry that that could be a direction that people are going. I think nation states right now are exploring. Unfortunately, they're exploring chemical weapons, and those international norms are degrading. But I worry that it's not too much of a step beyond that to go to biology. Milana, what do you think?
I have a lot of thoughts on this. I'm trying to hold myself from
we
saying.
have a few minutes for that. So
yeah, I was like, I'm actually watching the time. Like, how much time do we have?
You can spend as long as you want.
Yeah.
No worry.
So I've been thinking a lot about this, and I've been scaring the heck out of my students for the last 10 years, not just me, but a lot of experts, some, really terrific experts on this. Gigi, you probably know Joel. You know Joel, yeah. So anyway, and others. So for a while, as I've been hearing about these for years, basically the thing about biological weapons, biological weapons are not like natural disease. And there's nothing natural about biological weapons besides like actually the organism that's causing them. And even if it's like, say, anthrax or something like that, the symptoms and the amount of mortality, morbidity we can see from bioweapons can be completely different, by basically much more severe than something from a natural cause. So in the case of biological weapons, just due to the sheer doses potentially of the organism to which we're exposed and the natural route of exposure, and basically drugs in many cases like that, drugs or vaccines will not work. And so for years, I've been feeling kind of very vulnerable to this. And I didn't feel like I really had good answers for my students. But I think actually, I've been feeling a lot more optimistic. And I think the answer, and I know we're talking to a lot of people who invest in technologies. And here is a thing for you. I think the answer to this and to building our resilience to A, biowarfare, and B, natural pandemics are engineering controls. And I think they might not be, for pandemics, that's not, I'm not saying we don't need testing and vaccines and medical care. We definitely need all that. I'm a doctor, I love medical things, but I think really, if you look at, what's going to prevent it the most, I think this is where it's at. Because the beauty of it, if we are able to filter or clean the air, guess what? That's going to work for pandemics, because COVID, as well as many other organisms, spreads primarily through air. And, there's a lot of epidemiological data to put that. And guess what? This is kind of what bioweapons are all about, are primarily about. It's kind of by exposure through air. So if we're able to engineer our built environment, and I'm talking buildings, and I'm talking even vehicles, train, exactly, trains, whatever, to provide clean air, I'm not saying we've completely solved the problem, but boy, have we made a dent in it massively. And again, all we need to take that R naught to below 1. These solutions don't need to be perfect. They just have to be good enough to the point that, we really decrease transmission. And this is, and I'm talking about things like better ventilation, purification, how you direct the air, use of UV lights. There's a lot of opportunity for innovation there, which I think is being completely underutilized. And by the way, if I give talks on this, I've written on this actually. You can feel free to look up the paper on that. I briefed George. Actually, I wrote it with George Schultz, who unfortunately passed. But he was an amazing man. So actually, yeah. So we wrote a paper on this this summer, and also actually another paper wrote initially on basically the same exact idea a year ago. Actually 2 years ago, before the pandemic started. I think this is a solution, because right now there's so much emphasis on kind of what I call administrative controls or policy. Mm-hmm. Basically, stay home, commute, decrease the number of people in the building, try to not have overlapping shifts, decrease, all this stuff is great, but boy, this is onerous. This is very onerous for society to keep kids from school. Why not engineer buildings in a way where transmission is much less likely to happen? There are great studies on this. Actually, as Gigi knows, some of them funded by the Department of Defense, where they actually made experiments of using aerosolized vaccinia virus and using upper room germicidal radiation, and like simple fans, where that can be equivalent in some scenarios to like hundreds, thousands of air changes per hour. So, I mean, there are opportunities to innovate, and I feel like we're really not doing enough, because I feel like people don't know this is a solution space. And I realize it's a very maybe different way of looking at this problem, but I really think this is the direction. And this is why I'm so passionate about this, because I think, and actually, Simone, to your point, you made an analogy to cyber security. I made the same analogy also, actually, written about this in that paper. I think, in the 80s, when people started to experiment, with the computer code and building computers, nobody thought cybersecurity. And now cybersecurity is the thing. I mean, it's an industry, and the industry is not focused on debugging computers or treating people in the hospital, in the bio analogies. So much of it is about building firewalls, which were that's the thing. And I'm not saying completely lacking, but very much de-emphasized.
No,
so
but
I feel like,
I agree with you. I think
anyway, for you guys, yeah. Anyway, I'll get off my box.
No. This was excellent. And
sorry, I love this topic.
Yes.
Can I just add just like 10 seconds on this? Because I totally agree that indoor ventilation and healthy air is really something that we really need. And it's dual purpose or multi-purpose, because it's not just, there are studies that show that kids actually learn better and test better if they have healthy air, and yet and new buildings are usually built to that code, but we have a lot of old infrastructure when it comes, and we're packing kids into these spaces, and then we're surprised when it's maybe not as safe for high levels of carbon dioxide or high levels of COVID. So we want to make sure that we're addressing both things.
Absolutely.
So anyway, if entrepreneurs come to you guys looking for funding, feel free to talk to Gigi and I about it, so we can hook you up.
Absolutely.
The right experts.
I think that's an excellent idea. It's an excellent idea. Well, we are at the end of the hour, so unfortunately we have to stop here. But I want to thank you again for being with us as guest speakers. I want to thank the audience. Also want to thank Lily Sarafan, who very nicely introduced me to these two bright speakers that you have listened to today. And before we end, we have to tell you a couple of things. One is that we have a legal disclaimer. You should be able to see it on the screen right now. And you are requested or asked to read the disclaimer for the next minute or so. And also, Cota Access, the event that you just attended today, is a regular online event that we do every month. So stay tuned, look for Cota Capital or Cota Access online and sign up for future events if you liked this one. And other than that, I want to thank you all for having been with us. I want to thank again Gigi and Milana. And now we'll just let you finish reading the legal disclaimer. And then after this, we will turn off the event. Thank you for having been with us.